So, query from Meerut, Uttar Pradesh. Patient footfall, although 12 year in profession, still not getting the desired patient's footfall. Some days get a OPD of 20. Some days OPDs fall down to 4 to 5. Had done free camps, pamphlet distribution for promotion, but not great results. I must say, if you are living in Meerut, Uttar Pradesh, which is a tier 3 kind of a town only, you need to understand that you're using Nokia 3100 methods in 2023. These things worked 20 years back. They don't work anymore. Firstly, pamphlet distribution is not for promotion, it is for visibility. And that is only for new clinic for the first 3 months. So even after 12 years, you rely on pamphlet distribution, you are absolutely doing it wrong. Second, never expect results from camps. Camps have hardly less than 1% conversion rate. Anyways, do camps as a part of your CSR only, corporate social responsibility. Don't do camps for the purpose of conversions. Number 3, the real currency of today's world is social media. It is the new Aadhaar and the PAN of the digital world. And if you are not present on social media, if you are not targeting on social media, you're missing out on a big chunk of audience. Even a school-going kid has a mobile phone these days. Almost 90% searches today happen from this 5-6 inch device known as cell phone. So if you are not present on social media, you are not using social media for patient, I wouldn't say enticing, but patient awareness or being visible to your target group or being visible to your patients online, then you are missing out on a big traffic in your clinic. Now, OPD of 20 is cruel. OPD of 4-5 is medium to decent, provided you work on all. Now, I'm not really sure about the content of your query of 4A. You want only new patients, OPD of 20 or OPD of 4-5 every day, which is absolutely wrong. You should be more concerned about retention of your old patients rather than only new patients walking in. The perfect golden ratio is 70-30. 70 your old patient should be there, 30% your new patient should be there. Because in old patients, you have them knowing everything of your clinic. They know the ABC, they know the way of working, they know the system of working, they know the consent part. You don't have, they know the payment part also. They know your behavior part also. They know your timings also. Everything they know about you. But we have this mindset, hi, meri nayi OPD nahi aayi. I don't have a new OPD. Bullshit. That is just required 30% or 1/3. Why are you interested so much in that? So if you are just waiting for your OPD of 20 and 4 to 5, living on month-to-month or day-to-day survival, it is a wrong approach. If 4-5 are your old plus new in a day, I would say medium to decent. We don't need more than 8 to 9 patients a day. We don't need more than 8 to 9 patients a day if you're working on them. If you're doing just consultation, dawai likhna, parchi banana, then your choice. Chahe 50 ki karo, 100 ki karo. I don't care. But then doing more than 7 to 8 to 9 patients, workable patients, more than that is actually calling for dropping a bomb on your back and neck. Don't do that. Dentistry is a very, very stressful profession. We all need to understand that if we are not doing dentistry in a proper way, in an ergonomic way, we are creating ourselves as a ground for, you can say, lot many problems in future for our back. So, OPD of 20 or 4 to 5, you have to make a call how much you actually need. Old plus new percentage I gave you, camps as a part of CSR, pamphlet distribution, old way, outdated way, anyways not applicable on you. So why do you expect great results? Lack of social media presence, missing out on big chunk of audience, which is present online. After 12 years, if you're still resorting to the old, ancient ways of marketing, you know where the fault lies. You have to make an effort yourself. That is the only thing. I had good patient conversion ratio of nearly 90%, but when patient input is income is come, output is not up to the mark. Patient conversion ratio of 90%, but the income is not up to the mark. That means that probably your charges are not on the decent size, which means that your charges are the reasons for patient saying an immediate yes for you getting a 90% conversion. Even if you're getting a 70% conversion, that is close to the ideal rate. 7.2 out of 10 or 72% is the ideal conversion rate. You can get lot many out of that. If I go by your words only, this is your query continued in 4A, 4B. If I go by your version only, if you have a good conversion rate of 90%, that means you should have a good trust factor amongst your patients. Then why are you not having the OPD? Probably your service offering is not good. Maybe the patients feel, ठीक है, काम तो किया, but मजा नहीं आया. Didn't get the desired satisfaction. Unfortunately, there is no indicator to measure satisfaction. It relies only on a proxy indicator, which is the perception. How does the patient feel after the treatment? That is the perception on a proxy indicator. And if the perception is more than the expectation the patient carried in while walking into your clinic, then of course, the resultant S would be positive. Otherwise, the resultant satisfaction would be negative. That is where we can say we have to think the fault lies. Even after getting 90% of conversion, you are struggling with OPD, then the fault surely lies at your end only. Think about it. Whatever reasons I've given you, think about it. Of course, if you are attending it. I'm not sure whether you're attending it or not. So many who registered, actually, they're not even attending. So I see 41 participants over there. Anyways, coming to 4C, bargaining patients, especially old patients coming for a long time, whose entire family is coming to us, fear of losing a good bunch of patients if we resist. That is what I have always said. When you don't do marketing, you are dependent upon only a few set of patients, few bunch of patients. And there you lose your bargaining power. When I say this line to people, to many people, they don't believe me. They believe, nahi, sir, it does not happen like this. Now you have actually validated the thing that I always have been saying. Once you are dependent on that, they'll always have, doctor, we are coming to you for this many years. They came to you, you gave a treatment plan is good, 2 lakh rupees. Now they say, we are coming to you since so many years now. Now, we have never told you or never asked you to reduce, but this time for this 2 lakh, we will pay only 1.5 lakh. Now, you are in a position of fix. What to do? If you say no, you lose out on the whole family. If you say a yes, you burn a hole in your pocket. You don't actually earn anything. If you do a substandard job to make profit, you again have a risk of losing. So you are actually caught nowhere. Because they also know that your survival is dependent upon them. Now, once they have this belief that nahi, doctor bahut busy hai, appointment hi bahut mushkil se mili hai. If the mindset is such, the bargaining automatically goes out of window. Because patients believe, time mil gaya, kaam karwa lo, acha doctor hai, because that is the thing they don't want to lose on. And again, that makes a difference in your and their thought process. So that is why marketing is a big must. To have a consistent pipeline of leads, to have a consistent pipeline of patients. Once you have that, there will be a lot of chahal pahal in your clinic. There will be a lot of footfall in your clinic. As I said, this applies to query number 1 also, query number from A to I. So you all will get situations where you will feel that marketing is a waste of time. Marketing is actually the best use of time. If you don't do marketing, it all begins from there. If you don't do marketing, you'll have less patients. If you have less patients, you'll sell to less and 100% won't get converted. You'll treat less. You'll treat less, you'll earn less. Earn less, automatically, even those who are coming, they'll try to force bargaining on you. Ultimate answer, dissatisfaction. Dentistry is a bullshit profession. I'm going to change my profession and all that blah, 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 blah. Where did it start from? It started from marketing. And where we had again, at the cost of repetition, I'll repeat, where we had that notion, God, you're very unkind on me. I have so beautiful clinic. I have so good skill set. My patients, I have good conversion power. I have good selling skills. I can convey to my patients very, very emphatically. But you are cruel to me. You don't send me patients. God has to cater to another 1.5 billion in the country. Of course, not all of them are dentists. Dentists are only 3 lakh and most of them are not practicing. So 1.5, 1.8 lakh of dentists, there are other people also, which God Almighty has to cater to. So don't think that you are the special child of God so that he can listen only to you. God will also help those who help themselves. So make an effort yourself first rather than relying only on hope, wish and pray model. एक दिन वो दिन आएगा जब सब लोगों को पता चल जाएगा कि डॉक्टर भवदीप कितने बड़े डॉक्टर और मेरे क्लिनिक में फुटफॉल शुरू हो जाएगी. I'm just deliberately taking my example just to give you, exemplify your situation. So it's not like that. You have to make effort for it and then blame anyone else for it. If you blame everyone other than you, then you know where the problem lies.